Hi, my name is Maggie Patterson, and I'm applying for the Child Life internship at University of Iowa Stead Family Children's Hospital for spring 2026. I introduced Child Life Services as a department in healthcare that is a part of the multidisciplinary team, and Child Life specialists on that department serve as an advocate, resource, and support system for patients and their family during hospitalization. They can be seen in inpatient and outpatient services, and they provide developmentally appropriate resources and interventions for the patient to be able to cope with their hospitalization and or diagnosis as well. They provide interventions through developmentally appropriate procedural support and preparation, normalizing the hospital environment through therapeutic and medical play, and providing coping resources for the patient, caregivers, and or siblings that are present at the bedside during the hospitalization period for the patient. I am excited for the opportunity to complete my Child Life internship at this children's hospital for many specific reasons. One being the interventions used in the MRI and CT scanning interventions and process for patients that have to undergo these scans. The Child Life team developed a camping theme within those spaces to make it child friendly, but also be able to connect their developmentally appropriate interventions with the space to give the child a sense of control while preparing for those MRI or CT scans, and making the environment more comfortable while being able to educate them on every step of the way throughout their scan and what to expect. Additionally, I am passionate about working across various different units and specialty departments. I think that the exposure that I will get to the specialty units, including dermatology, urology, transplant, renal dialysis, and then the inpatient units, including the neonatal intensive care unit, the medical surgery unit, hematology, oncology, and pediatric critical care, will give me a diverse range of learning opportunities and exposure to many different pediatric diagnosis cases that I can expand my knowledge on, as well as expanding my clinical skill set when collaborating with medical professionals and providing patient family-centered care as well throughout these experiences. And additionally, with that, the facility dogs provide great resources in assisting with animal-assisted interventions for patients to be able to achieve those interventions throughout their hospitalization. Currently, I'm working as a child life assistant at a pediatric rehabilitation hospital where I've had the opportunity to practice patient family-centered care, and on weekend shifts, we organize family sessions in the playroom, which are individualized for each patient and their family to come into the playroom and normalize the environment. So recently I had a family that had a patient in the hospital, and mom and dad wanted to bring in older brother to be able to normalize the hospital environment and also expose him to the patient's medical supplies that was needed. So this included oxygen tubing and also an NG tube, and parents just wanted to expose this to sibling throughout a form of play and something that was comfortable to the older sibling and that he had control in. So I was able to help facilitate this in the playroom and help engage in developmentally appropriate normalized play, exposing the hospital environment and normalizing that for the patient, and then also encourage sibling and family bonding as well as a way that I practice patient family-centered care. I would describe myself as the song Shake It Off by Taylor Swift. Any situation I find myself in, I try to look at it with the half glass full motto, trying to remain optimistic, flexible to changes and adjustments, and remaining positive no matter what. Thank you so much for listening.